My name is Anna Curry. I'm a third-year medical student at Queen's, currently live in Kingston, originally from Toronto, but Kingston is home now. I am an organizer of a group of medical students who have been working to collect PPE donations from the community, and together with our partners from the Ontario Medical Association, distribute them to healthcare professionals in need. Even before this all started, I was doing an anesthesiology rotation at Kingston General Hospital, and I was seeing the preparations that were being made for the pandemic. And yeah, it might be for the selfish reasons that I just want to make sure our healthcare workers are protected. I have so many friends, you know, they're nurses in the emergency room, and they were only allowed one mask per 12-hour shift, and it's just not safe. And I was seeing this extreme need that wasn't being at that time filled by our government, unfortunately. Now I think there's more and more suppliers that are vetted properly, and so the supplies are coming through. But in the beginning, there was really nothing because we just weren't prepared. So I just saw this acute need, and I asked for help from my colleagues, and they were more than happy to get this started, and then it just kind of snowballed from there. We have about a group of 50 students who are helping us. We've also partnered with Project Northern Lights, and we have people from there helping us, and community volunteers who are sewing gowns for us. So it is quite a large operation. The amount of sort of work that we do varies from week to week, and it was very front loaded, and it was a lot of work early on. Kingston has been doing great. I'm very proud of us as a community. And in terms of things that I've seen from our community just from starting the PPE drive is just huge generosity, and like they truly care about people and about helping out. And it was overwhelming for the first month to see the amount of emails and donations and responses we've been getting from just saying, hey, we need donations of PPE to help our healthcare professionals. So that was really heartwarming to see. I think for me, the biggest lesson that I've learned is being kind to yourself and to others around you is really important, especially in times of stress. You know, not setting very high expectations for yourself or for the people around you, and just recognizing that everybody's doing their best. And these are unprecedented times, and you know, people are struggling in ways that you may not know about. So just having that in the back of your mind going forward, I think outside of the, you know, context of the pandemic is a helpful lesson for me to just know that kindness goes a long way.
I'm Sharon. I'm a third-year Queen's medical student, and I'm the current president of the Ontario Medical Students Association. I'm from Toronto. In response to all of the medical students in Ontario getting pulled out of their curriculums, we've been trying to find opportunities and ways to engage medical students in COVID-19 relief efforts. And so one of the big kind of parts of that has been working with the Ministry of Health to find positions within the ministry that students can help with. My motivation has really been in seeing how much energy and creativity is in all of these other medical student initiatives, and wanting to bring those together. Because certainly I think like the options that we're using, like virtual care, things like that, have benefits in terms of being more accessible to our patients, and things like that. So that'll be and it'll be interesting to see how that plays out in the future of my practice. You know, I see med students doing PPE drives, or volunteering to take care of people's children, or like, you know, volunteering to run errands for essential workers or pick up groceries for seniors and things like that. And I think, you know, all of those problems have existed pre-pandemic, but it's really now in this era of the pandemic that we're seeing those needs amplified. And I think in that way, we're kind of stepping up to meet those needs. I think I certainly feel really privileged because I live in a safe community, and I live in a place where I have access to a lot of resources. But thinking about, you know, different people's experience in these challenging times, and really not letting this like experience just pass us by, I think I would really challenge people to reflect on what these times have meant, and how they can shape what we do as a society moving forward.
My name's Daniel Sheet. I'm currently a second year medical student here at Queen's University. I'm originally actually from Brampton, so that's a little suburb outside of Toronto, but currently I'm staying in Kingston. Currently, I'm the communications and outreach coordinator for K-Health, which is an initiative started by one of my peers in my class. His name is Valera Kastanov. And what K-Health aims to do is it brings together interprofessional students from all across the Queen's Faculty of Health Sciences, and we work to connect students from the university to helping their community. Definitely, I was not expecting to be working in this role a few months ago. With the COVID-19 pandemic popping up, and a lot of changes have had to be made, and things look a lot different for everyone now than they did a couple of months ago. One of the things that's great about K-Health, though, is that as an initiative, it is really flexible and it responds to sort of the needs of the community that happen as the environment changes. So one of the things that has happened is that we've started something called the Student-Run Community Support Program. And what this does is it primarily aims at providing social support to members of the Kingston community. So generally what happens is when someone needs groceries or someone needs an errand done for them, they'll contact our organizational team. And what we'll do is we'll actually do a contactless delivery. So after it's coordinated over the phone what they want and the price, we'll drop off the groceries and receive the cash by e-transfer. So one thing I would actually like to share is that, so this was part of our student-run community support program. And there was a senior who wanted to exercise and how to stay fit during this pandemic by going out on little runs or little jogs. But the problem is he didn't have any gym clothes to help him achieve that. So one thing or one thing that we've helped him do is to bring some of those clothes for him and help sort of just go out and get those clothes for him and bring it to him. So like that in itself, helping him, I thought that was a very positive effect on our end. But also what I was impressed by was his perseverance and his willingness to stay healthy. And we were very happy to be able to do that for him. As a summary, I think that generally what I've learned is that we have a lot more capacity to help them than we initially think. And I think that's true for almost all students. The way that students have come together and what I've witnessed and all the initiatives we started and stuff we've done for the community, I think that's generally, that's very impressive. And we could have never thought of that or even imagined it before the COVID crisis. So I think there's always a little bit of positivity in every negative event, and that includes the COVID-19 crisis.